I have cancer. As I look around the room, I can see the emotion that those words create. Now imagine the words are, you have cancer. 3 words that no one wants to hear. When we're faced with these words, we become acutely aware that the world needs less judgment and more understanding. The word cancer is scary. I chose to share my diagnosis openly. I was in great shape. 2 days before my first screening mammogram, I had the best physical of my life. After, I had this little problem of cancer. I learned very quickly that in sharing the fact that I had cancer, it yielded many strong reactions, often of sadness, anger, fear, and grief, none of which had a thing to do with me or my diagnosis, all of which were a projection of the individual's bias or experience with the word cancer. According to the World Health Organization, the word cancer is used to describe 200 different diseases. There was a time not long ago where a cancer diagnosis was considered an automatic death sentence. While the rate of cancer incidence is holding steady, I am pleased to say the percentage of people surviving is on the rise. What if we believe that cancer is no longer an automatic death sentence? What if, when faced with this now generic term cancer, we can go to a place of curiosity? Many stories come from a cancer journey. People you never thought would support you are front and center. And people you thought for sure would support you have disappeared. It's a weird time. Today, I want to share with you the unspoken truths of my cancer journey so that if you find yourself facing this challenge, you're better prepared for the unknown. Truth. We don't know what we don't know. And when it comes to a cancer diagnosis, what we don't know far outweighs the facts that we do. No one plans for a cancer diagnosis. The type, the stage, the elegance of the treatments available are unique for each individual diagnosis. Yet, everyone you tell wants to know why it's happening. Or worse, they want to tell you what you should be doing, what you shouldn't be doing, and what they're doing to keep it from happening to them. It's been my experience that this keeps people stuck in a place of isolation, or worse, holding themselves responsible for something they may not be responsible for. Genetics, environment, lifestyle, a combination, all have a role to play. And sometimes it's just bad luck. We have to stop blaming patients. Cancer's hard enough. I worked with clients for cancer survivors for over a decade before I had my diagnosis. I was a weird patient. I came to the conversation with a lot of information. I wasn't drinking from the fire hose or coming from a terrified place of the fear of the unknown. In fact, when my surgeon was prepping for my biopsy, I said, I'm sure people who have too much information are a real pain. But I decided a long time ago, if I was faced with this challenge, I'm taking them off and I'm getting an upgrade. She also laughed and agreed that based on my other results to date, that we were just figuring out what flavor of breast cancer that we were looking at that day. Knowledge is power. When we're able to really dig into the information and see how it specifically applies to us, we're able to set aside fear and create opportunities for powerful choices. Truth. You are the expert of your own body. Period. End of sentence. As humans, we sometimes become disconnected from our body. Let's be honest. Some of you take better care of your cars and are more connected to your phone than you are to your body. But I promise, if you start to pay attention, you'll see very quickly what's normal for you. And what's normal for me doesn't always follow the general population. If there's a side effect that happens to less than 10% of the people, that's me. Sign me up. And I'm not alone. The problem is doctors have 8 to 15 minutes on average with each patient. And if you don't fit in the box or follow a pattern they readily recognize, they may not have time to understand what's happening with you. And I feel for them. The burnout rate in the medical profession is alarming. Add to that the fact that not all cancer is found early, and not everyone survives. Your team is faced with sadness, anger, and grief on a regular basis, and we no longer give them the space to not have all the answers. Yet, how can they? Truth. Doctors are there to guide you and treat you. They are not all-knowing beings. Doctors' offices are called a practice for a reason, right? If I was told one more time that a condition that I was experiencing every 3 weeks in conjunction with my chemo treatment was not normal and possibly not being caused by my treatment, I was going to scream. I didn't have this issue before treatment, and I haven't had it since. I think perhaps it was caused by my treatment. Ask questions and keep asking until you get an answer that makes sense and that you understand. It's when we can partner with our doctors to feel heard and understood that we find the best way forward. What if the medical system was disrupted to value understanding the outliers? What if, when we look at the weird issues, we find it's actually much more common than we thought, but it's going undocumented because doctors consider it not normal? The end of treatment is not the end. Surviving is just the beginning. This is by far the most common thing that I hear from survivors that I talk with. We emerge on the other side of treatment. Life gets a little lonelier, and we're no longer the same. It's time to figure out our new normal, and there is no one-size-fits-all manual. In fact, there's no manual at all. Maybe you rang the bell at the end of chemo, and the doc said, "See you in 3 months." You go from weekly appointments, a direct line to the nurse's station, to "See you in 3 months." Maybe they gave you a survivorship care plan. Most likely, they didn't. We finish treatment, and everyone believes you're back to 100%. I thought that was going to happen myself. My chemo was in 3-week cycles. Week 1, I was tired. Week 2, I was better. And week 3, I was back to normal. Except the needle on normal was moving in the wrong direction, and I was unaware. I thought, week 4 after chemo's over, I'll be back to all my normal activities. Boy, was I wrong. Yet it's what we expect if no one prepares you for the alternative. Before my treatment, I walked my dogs. 2 to 4 miles a day, and I ran 5 miles 3 days a week. Shortly after my treatment started, a condition affecting my hands and feet prevented me from continuing to do that. Caregivers take on so much. My husband was picking up all my slack, and I was anxious to take things back off his plate. I am not a morning person. I have never been a morning person, and that was extremely clear when I started trying to get back to my normal activities. In fact, mornings were exceedingly hard for me until just a couple months ago, and it's been 2.5 years since my treatment ended. I tell people you have to get curious about what works, what doesn't, and then adapt. Surviving really is just the beginning. In December of 2018, the New England Journal of Medicine published an article entitled Cancer Survivorship. The author talks about the long-lasting and late-occurring effects of cancer treatment. Of the 23 conditions cited, 16 were listed as common, and lymphedema didn't even make the list, even though 1 in 5 breast cancer patients who have lymph nodes removed are diagnosed with this debilitating, misunderstood, and untalked about condition. I'm one of them. And that's an entire conversation for another day. No one prepared me for the long-lasting effects of my treatment. Let's talk about chronic pain. I often see survivors post about scar pain, scar tissue pain, often years after surgery, and it's almost always has some reference to fear of recurrence. I happen to have a knee that has accurately predicted the weather for over a decade. And when I experience that same scar pain, I'm able to check it against my magical knee. And that allows me to put my fear at ease because I know it's normal and it's not something to fear. But chronic pain and fear of recurrence is real for survivors. Let's talk about cognitive dysfunction. I love to knit. I'm a fairly avid knitter. I've been knitting for a long time. I could not knit for the year of my treatment and the year following. I have several pieces that are riddled with mistakes. Others I just simply couldn't do. It wasn't until after I had stopped all the medication that my brain was able to start to heal, and I was able to get back to knitting happily. It was no surprise to me that depression, anxiety, PTSD, fear of recurrence, and issues concerning return to work are also common conditions. The American Cancer Society cites that 36% of survivors don't return to their job. Imagine you have chronic pain, cognitive dysfunction, a metabolic syndrome causing uncontrollable weight gain. No wonder we're depressed, anxious, traumatized, and having issues returning to the normal course of our work and our lives. We have early detection, more targeted treatments, more people are surviving. And now survivors are commonly facing potentially 16 debilitating conditions that we're unprepared for. Because the goal at the end of treatment is to be alive. And I'm happy to be here to talk to you about that. But we don't have the supports to navigate what being alive means. What if we had the support built in to the plan of treatment, not in the form of a support group or more medication, but as an additional member of our personal wellness team, someone to help survivors bridge the gap from treatment to getting back to living fully. Truth. I don't know one cancer survivor that hasn't changed something significant about their life after their diagnosis. We understand clearly what Andy in the Shawshank Redemption means when he said to Red, it comes down to a simple choice, really. Get busy living or get busy dying. Survivors leave careers where they felt unappreciated. They reevaluate relationships where they found they were unsupported. Or, like my husband and I, they doubled down on relationships where they found support to be unwavering. And we unapologetically get busy living on our terms. Adversity creates strength. Curiosity breeds invention. And the judgment of others can stop us in our tracks. It's through our ability to make choices for our own higher good that we're able to tap into our power and shift from a place of imbalanced uncertainty to unstoppable possibility. Let's keep shedding the light on the unspoken truths of cancer and support the estimated 16 million Americans who are surviving cancer. Support them emerge from treatment whole and unstoppable. Thank you.